Thanks very much. Good morning. I think it's still morning. Ladies and gentlemen, thanks for that great introduction, Tom. I almost feel like sitting down and letting the experience that you gave everybody about me waft over the audience in case I say something that might lessen your opinion of me. But I'm delighted to be here. I'm very, very supportive of the study that was produced and distributed this morning. And that's why I accepted Tom's invitation to be here. I'm going to talk about years of animation for global health. I'm going to cover a lot of ground in 20 minutes that I've been allocated. And after that, I'm glad to have discussions about any aspect of them, because in fact, on many of these points, I could give a 3-hour lecture rather than go through it for 20 minutes. But the animation for training is leading edge. Now that sounds a bit strange to say, but most of the animation, most of the training so far has been in pamphlets, brochures, manuals, and handouts. It's been a lot of print and newspapers. Then it moved to radio. Then it moved to long-form television drama. And in fact, yes, just 2 days ago, for example, the Peabody Award was given. Peabody is a very prestigious award in the US, was given to a South African production called Intersections, which is an SABC drama on HIV/AIDS prevention. Then there's documentaries, and I do produce a lot of documentaries, and then animation. So first of all, we started off with what is called long-form animation, which is basically animated television series, particularly for children. Then there are hybrids, and Sesame Street is a good hybrid, where you have both animation and live action and puppetry all mixed together in the same episode that gives out messaging. Then you have live action short form, which is very short, usually 30 seconds or a minute, which is live action. And finally, the animated short form, which is what I'm mainly going to be talking about today. So why using animation? First of all, the audience is accepting of animation. Well, you know that what you're seeing is not real. There's now a global acceptance of animation. Animation is absolutely around the world. There's non-realism. So you know that what you're seeing is not real. Now, one of the things that I'm going to show you is a campaign that I produced called the 3 Amigos, which is on HIV/AIDS prevention, and 3 funny animated condoms. In many countries, there have been campaigns using real condoms before the 3 Amigos came about, and they were thrown off the air for various political reasons, for various reasons. Audiences didn't like the fact that there were real condoms being shown on national television. But if they're animated, they have arms, and they have faces, and they talk, the people are more accepting of them. They know that it's not a real condom, and therefore they're more accepting and less objective. They don't object. You have what is called a suspension of your disbelief system when you look at animation. You're not disbelieving of what you're seeing because it's animated. Again, you know it's not real. It's easy to translate. I hate to use the word translate because I can give you a lecture on how we do them. I actually never translate anything. We rewrite the scripts in every single language that we do them in. But they are very easy to translate because the lip sync is easy to sync in other languages. You can reach virtually any audience, anywhere. Any age, any group, any demographic, anything that you want to think of, adults, children, and anybody in between. It allows for universal characters. You know, I come from Canada, and if you see a Canadian government ad, for example, you'll see one black person and one white person and one Asian person, and they're trying in the one particular government ad to have the whole of Canada represented. But if you have animated characters, you don't need to do that because you can make universal characters that actually anybody around the world can identify with. And it allows for innovation much easier than live action does. So, why am I blank? Okay. The advantages of animation. It's the easiest way to reach very large numbers. And some of the, in the introduction, Tom mentioned, some of my work has been seen by over 1 billion people in over 150 countries. And I'll give you some other examples where over 2 billion people have seen animation. It is highly cost effective. It is the most difficult and the most expensive way to make media. Most animated movies, Disney movies, for example, cost well over $100 million. Some of them cost over $300 million. But animation is actually a very cost-effective way of getting a message out, especially on prevention. It provides more choices. It gives you a huge variety of choices. So one of the things that I'm going to show you is my production on malaria prevention called Buzz and Bite, where I created 30 animated spots on malaria prevention. Now, it doesn't mean that I expect any broadcaster or anybody else to use all 30 spots. They will tailor-make and take those spots that they want to use in that particular circumstance for that particular audience. So in the Three Amigos, the HIV/AIDS one that I mentioned, the most I ever heard any broadcaster play is 11, and that was Mozambique television. They had 20 spots. So they took out 9 spots. They thought it didn't work or wasn't right for the audience or whatever, and they took 11 spots, and that's my approach. It's always to give a huge variety of choices so that you can take out of it whatever it is that you want. We provide a variety of formats for distribution, and I know from previous conversations, people ask me, how do you get this out? How do you distribute it? How do you get millions of people, hundreds of millions of people to watch it? Let me give you one example here, South Africa. Just the Three Amigos, just HIV/AIDS. So it's one campaign, one country. Then you have to multiply it by 150 other countries. Every country is different, but let me give you the example of South Africa. So the HIV/AIDS one, which is called the Three Amigos, was played by the South African Broadcasting Corporation, the SABC, for up to 20 times a day for 2 years in 4 official languages. It reached at least half the population of South Africa. In fact, it became so popular in South Africa that at one point, apparently, I didn't test this myself, I was told you can walk into a pharmacy and ask for an Amigo, and they know that you're asking for a condom. So it got into the popular vernacular of the country. They were beamed up onto a satellite-based community health system that goes to 1,600 community health clinics across South Africa. They were played in jumbotrons in the middle of soccer matches. They were played on trains. They were played at bus stations. They were played in numerous universities. In fact, one of the universities here in South Africa, I don't know if they still did it, they did it a few years ago, insists that all their incoming students watch the Three Amigos. It's part of their introduction to the university. They played on closed circuit televisions at universities. They're obviously taken and used by a large number of NGOs when they go out into the field. And by the way, since we're talking about mobile, if you now have a phone, an iPhone, you can broadcast, you can actually project using a mobile phone with an app. So you can have the animation on your mobile, and you can project it onto anything. I mean, I could project it onto that wall right there, for example. They have something here called the FRU, which is a Film Resources Unit, which is a part of the government which they take trucks and they go into villages and they project movies onto the truck so that the villagers have movies to watch. They played the Three Amigos before movies started. They actually played the Three Amigos also in a national cinema channel